All right, what I'm going to show you guys today is information about manual blood pressure cup. So this here is blood pressure cuff. Opens like this. Essentially, you want the artery underneath that. You wrap it around like this. This should be removable, so if you want to put it on a shirt, or you can clip it here. This here pumps it up. If it doesn't pump, you close it, so righty-tighty. Starts to pump. I'll show you the pressure as it goes up. To release it, lefty-loosey. Comes out. So how blood pressure actually works, so you need a certain amount of pressure in a pump to get it to go around in a circle. Or I'll turn this around. Hi. So you need a certain amount of blood pressure. There's a force, and that's going to be a systolic, or the amount of pressure that it takes to squeeze blood through with the heart. You always get a blood pressure with a top number and a bottom number. You don't want to lose the pressure in the line, or in the hose, and the veins, so there has to maintain a certain amount of pressure. That's the heart at rest. So systolic, diastolic. Diastolic is going to be the bottom number. It always has to be lower because the heart is at rest. With blood pressure, you can't hear those numbers until you actually pump it up. So you'll want to feel where the artery is, and I talked about that in the previous one, but it's basically on the inside of your elbow. And if everybody wants to kind of put two fingers there and find their pulse there at their elbow. So essentially like right here, you should be able to feel it. This is where you want that stethoscope. So this here is a stethoscope. If you can't hear it on one side, they do rotate. Use the bigger one for your blood pressure. So it'll go right here. You'll put your blood pressure cuff on, and you'll start to pump it up. When you start to hear that pounding of the heart, you're going to continue going. You'll go until you can't hear it anymore, and you'll go up a little further, usually about 10 millimeters of mercury. You'll slowly start to let it out. The second you hear a bump or a heart rhythm or a beat, that's going to be the wave punching through the pressure you're releasing. So you've squeezed it so tight, you've essentially tourniqueted it. And as it releases the pressure and some blood gets to flow through, that's when it actually starts to make noise. You can hear it. You're going to mark that as the top number. You're going to continue releasing pressure. You can go a little faster in the middle. Because remember, you found out where you first started hearing this. So let's say you found it at 80. You had to go all the way up to 140. You find their pulse at 128. You know that you found it at 80. So you can start going down fairly rapidly until you got to 90. Then you're going to slow down again. And when you can't hear it anymore, that's going to be your bottom number. That means that the pressure is actually less than the amount, or more than, the pressure in the cuff is less than the amount of pressure that is in the residual remainder of the heart. So top number when you first hear it, bottom number when you no longer hear it.